On Monday, the U.S. Department of Health and Human Services is considering whether to declare monkeypox a public health emergency if current management tactics don't get the virus under control. Speaking to reporters in Washington, White House COVID-19 response coordinator Ashish Jha said that the emergency declaration from the WHO will allow the United States and its partners to collaborate, share data, and get information out to critical communities.
He stressed that the United States has a 4-stage plan to test and treat the virus in the communities most affected. He added that the group most affected in the U.S. is the LGBTQ community. However, Dr. Jha emphasized the importance to not use this moment to propagate homophobic and transphobic messaging. Up until July 25th, the CDC has reported just under 3,500 cases in the U.S.
Very clear at this point that the community most affected is the LGBTQ community. This is one of the reasons why I said we've been deeply engaged with them, both to share information, also to learn more, make sure that everybody's communicating in a way that's both scientifically accurate and respectful. Obviously, it's really important that we do not use this moment to propagate homophobic or transphobic messaging, and I think it's really important that we stick to the science, stick to the evidence, and do it in a way that's respectful of people.
So where does the monkeypox centralize right now? In the UK, in European countries, and also in North America, as we just seen the package, right? It is still very uncommon right here in the Asian countries, especially Indonesia. So one might wonder, what is a monkeypox, right? Is it the same as chickenpox? So it is a blister kind, like chickenpox, but it's larger. And then they typically start from the head to the neck and not in the central, in most patients. This is according to Department of Health information. And the numbers of blisters varies from a couple to thousands in your body.
A couple to
thousands, right? So how do you contract a monkeypox? So the disease spreads chiefly through a close contact. Now, avoiding close physical contact with infected people is the most effective way to prevent infection. What are the symptoms, you might ask? It's the same as chickenpox. Fever, swollen lymph nodes, headache, body aches. Symptoms are usually followed by distinctive rash that may appear on the face, inside the mouth, palms of the hands, and soles of the feet. And the amount of time, it's varied. It could be from 7 days to 14 days, but it also can range from 5 days to 21 days. Is there a cure for a monkeypox, you would ask? Yes, so monkeypox, it is still rare, and it has also proven fatal, but there are vaccination that is out there, especially in the Western countries. Australian Department of Health also stated they're ready and they're required and they're ready for treatment and vaccination. And those who become infected may need a simple pain medicines and oral fluids with a healthcare professional monitoring their symptoms. So again, this is maybe still very uncommon here, but we have to, get ready for it and whatnot. And hopefully, monkeypox is the same as the pox family.
like the chickenpox.
Right. So there was smallpox before, and then we stopped having the vaccination in around 1970s, if I'm not mistaken, like a piece that I read. But smallpox, we've discontinued the vaccination, but we kept on having vaccination for chickenpox. So this is still from the family as of right now. Again, that's why it's not kind of surprised that I do have the vaccination with the monkeypox. But then again, right now, the scientists and the medical service need to kind of reevaluate again of the smallpox, because it's coming from the same family. Do we need like a mandatory immunization and also vaccination?
But as we saw earlier in the footage, also on the late information that we gave to the audience, it's about how the monkeypox is actually circulating among the LGBTQIA community. And that being said, Dr. John Briggs, as the Chief Medical Officer for the CDC's Division of HIV and AIDS Preventions, anyone can develop this monkeypox infection, but many of those affected in the current global outbreak identified as gay and bisexual men. And some groups may have a greater chance of exposure right now, but by no means is the current risk of exposure to monkeypox exclusively to the LGBTQIA community. So it is like what we saw earlier in probably last 2 years. It's about how COVID-19 was found in the community or in China and in the Asian area, in the Asian region. So this should not be a tool for people to discriminate one certain group of people in that sense.
Yeah, just like COVID-19, it's been, it's a part of the flu family, right?
Exactly.
Yeah.
Exactly.